So as a tutor, I get asked this question a lot, and that is, how many questions do you need to practice before you take your NCLEX? And let me warn you, this answer can vary widely depending on who you're asking, and a lot of different factors, such as, did this person have a good foundation prior to taking the test? Did this person have a time restraint prior to taking the exam? Vice versa, say if somebody felt like their foundation wasn't very well, maybe they're going to have a lot of time that is needed to actually revisit information, also with practicing more questions, etc. So for example, let's just say this person have a time restraint or they start off with a good foundation. Most of the time I hear people around 1,000 to 2,000 questions. On average, I hear it is about 3,000, sometimes 4,000, but there is even rare occasions where I hear it's 5,000 and up. It really depends. And there are some rare occasions where I heard people practice for 3 days and that was it. That was the duration of study that they had prior to taking NCLEX, and they still pass. So it really comes back to the question, just how many questions should I practice before I take my exam? Welcome to Nursing Unveiled. Here we uncover all the tips and tricks on how to jumpstart a successful nursing career. To start off, I think it is very important to have a brief understanding as to how the nature of the test works. So the way it is programmed is you start with easy level kind of knowledge-based questions, and then as you progress along, you're more towards the application side of questions. And with that said, based on the experience that I have, as you progress along, you should see more and more SATA questions or select all that apply questions as you move along in your test if you are doing well. Now, understanding this is very crucial because it means you cannot just simply base it off of memory for a test like this. You have to be able to connect and actually have the bigger picture in mind to understand how one part might affect another part, etc. Which means it doesn't matter how many questions you're going to practice if you do not understand the reasoning behind those answer choices. So you definitely have to do the work, especially if you feel your foundation is a bit shaky. This means you probably have to take some time and read back on some of these concepts and bigger topics to make sure you understand it a little bit better in order to even attack practice questions. Because the worst thing to do with these practice questions is simply just aimlessly guessing on answers, because that misses the whole point of you critically thinking through and logically thinking through a question to try to come to the right answer. Another point I want to highly emphasize is make sure when you're doing questions, you're reading through the questions, you're reading the answer choices, but make sure you read your rationales and take notes on your rationales and go back to the answers to make sure you understand why those answers are wrong and why those answers are correct. Because that is when you actually finish up on the question. It's not simply just going through the question, answering, and just read through the rationale and that's it. No, make sure you take notes on the stuff you don't understand and make sure you revisit it towards the end so you truly ensures that you have understanding of that knowledge. So remember when I was talking about application type question? Well, this is exactly what it is. You want to be ensuring that you are able to apply what you have learned to future questions. So that means you have to read the rationales and take notes on the rationales and revisit those notes to really make sure you understand. It doesn't matter how many questions you do if nothing sticks to you. It just goes back to the saying, you cannot apply what you don't know. And that would only come if you have good knowledge foundation. So especially for those of you who have not passed the exam, ask yourself this question: do I feel confident in ensuring I will get the questions that I got wrong correct this time around on my practice questions? And do I know why those answer choices are correct and why those answer choices are wrong? So when I was studying for my NCLEX, that's the mindset I had. And so most of my studies was actually dedicated to patho and med-surg review, in-depth review from my own notes, and also some of these review content guides. And so from there on, that is when I felt like I had a better understanding of what I was looking at in order to make sure I practice questions in the right mindset in which I am able to critically think through answer choices to see whether that is a more accurate assessment of my performance. Because let's face it, it's also discouraging if you felt like you're getting every single question wrong or you just don't feel like you're confident enough in answering these questions. So to give you an idea, I did about 1,500 questions roughly and another about 700 to 800 Kaplan Q-band questions. And so altogether that is about 2,200 to 2,300 questions that I practiced before my NCLEX. The reason why I did Kaplan is because due to my Kaplan Predictor exam that I was gearing up for before I could graduate from the nursing program. So that's how that broke down. If you guys want more information on Kaplan or Uworld or my Kaplan Predictor experience, I'll also have a video and I can link it up here and also in the description box down below for you guys if you're interested. Also, if you're enjoying this content, please consider liking and subscribing to continue supporting this channel. So as you can see, the number of questions that I practiced was much lower than than 3,000 to 4,000. So as I keep on mentioning, do not base your studies on how many questions you can get through, but rather how many questions you can retain. That is the key to success in your NCLEX studies. So on test day, I managed to finish my exam with 77 questions, and this is back when the test has not changed yet, and the minimum amount that needs to be taken to pass the NCLEX was 75 during this time. And if you're new to my channel, I even talk about how I managed to even squeeze a week of vacation before my exam date. So if you're interested in that video as well, I will link it up in the description box down below for you guys so you can check it out and see what I did to gear up for NCLEX when I was having to balance vacation. Alright, so the million-dollar question is, how many questions should I practice before I take the NCLEX? So what I recommend is you must complete at least 1,000 questions, but preferably I highly recommend that you do 2,000 or more. And make sure you understand every part of the question and answer choices that you put on that paper. Hopefully this answers the question. And if you like this channel, please don't forget to like and subscribe. I have new videos every week, so stay tuned. Bye!